Every case has a story, a fall, a fracture, a fight to get back up. But behind every recovery is a system, a strategy, and a team that moves fast when it matters most. This is Case by Case with Aaron Shaw and Claudia Wilson. Real challenges, real recoveries, and the systems that make them possible. An Injury Guard Solutions production.
When someone gets injured at work, it's a big deal, isn't it? It throws everything off track.
Absolutely. It's not just the physical pain. It affects their whole life, their job.
Yeah, and getting back to work. It's more than just the body healing. It's about feeling confident again, being mobile.
Regaining that sense of normalcy.
Exactly. So today, we're doing a deep dive into something that plays a huge role in this, but maybe doesn't always get the spotlight. Durable medical equipment, DME.
Right, DME.
Our mission here is to kind of uncover how this equipment isn't just stuff, how it actively helps speed up healing, restores function, and really ensures rehabilitation is safe and works well.
So people can get back to their jobs sooner and feel capable doing them.
Precisely. Okay, let's unpack this.
Well, DME, it's interesting because it's so fundamental. Basically, durable medical equipment refers to these, specialized medical devices.
Prescribed by a doctor.
Prescribed by a healthcare provider, yes. And they're designed for longer-term use to support recovery. Crucial in workers' comp cases.
Because they help people manage outside the clinic.
Exactly. We're talking things like mobility aids, your crutches, walkers, maybe a wheelchair, things for safe movement.
Okay.
Then you've got orthopedic supports. Think braces, knee braces, back braces, or splints. They give stability, keep things aligned.
Right. Important for proper healing.
Definitely. And pain management. Things like 10NS units, those little devices using electrical currents.
Oh, yeah, I've heard of those.
Or even just hot and cold therapy systems, non-invasive relief, plus rehab equipment like CPM machines after surgery.
Continuous passive motion.
Right, gently moving the joint. Or simple therapy bands. And sometimes even home hospital stuff like adjustable beds or patient lifts. They can make a huge difference at home.
Wow, okay. That's quite a range. It really makes you think these aren't just optional extras. They seem pretty foundational.
They really are.
But beyond just knowing what they are, what about the maybe less obvious impacts? Especially sort of the psychological side of getting back on your feet.
That's a really important point. It goes much deeper than just physical support. Providing the right DME often reduces a lot of anxiety for the worker.
How so?
Well, imagine you're scared of falling or re-injuring yourself, or just frustrated you can't move easily.
Yeah, that must be tough.
Having the right brace or walker or maybe that lift at home, it can make you feel safer, more independent, more in control.
I see, that sense of security.
Exactly. It's psychologically vital. And getting the equipment quickly is also critical. Delays are bad news.
Why is that?
Delays can mean more pain, more stiffness. It can make the worker feel helpless, and that can actually slow down recovery. Costs go up too.
Right. Longer recovery, higher claim costs. So for employers, getting DME sorted quickly is actually cost effective.
Over the long run, absolutely. Fewer lost work days, faster return to productivity. It's a smart intervention.
That makes total sense. The mental load of an injury, it can be just as bad as the physical stuff. DME helps bridge that.
It really does.
But what are the usual snags, the hurdles in getting this equipment to the people who need it? And how do provider services fit in?
Yeah, the process can be surprisingly tricky. You've got insurance approvals to navigate, which can be complex.
I can imagine.
Then ensuring the equipment is actually right for that person, their specific injury. Customization matters. And then just the logistics, getting it delivered on time, set up properly, and crucially, teaching the worker how to use it safely.
So they actually get the benefit.
Precisely. That's where these integrated provider services are so valuable. A good provider, maybe like an Injury Guard Solutions, they act as that vital link.
Connecting the dots.
Exactly. They work with the doctors, manage the delivery, the setup, provide the training. They often help smooth out the claims process too.
Taking stress off the worker
and the employer. It removes delays, removes frustration. It's really a holistic approach, physical, practical, and emotional support.
Okay, it's really clear now. DME isn't just hardware, it's a catalyst, a real game changer for recovery. It enhances mobility, helps manage pain, supports the whole rehab process. It gives people strength back, confidence back, helps them return to work faster and safer. So what does this all mean for your understanding of recovery pathways and workplace support?
Well, maybe here's something to think about. Beyond just the physical tools themselves, how does getting the right DME at the right time combined with really effective support services. How does that whole package contribute to an injured worker's psychological well-being?
The bigger picture.
Right. Does it foster more than just physical healing? Does it build resilience, a lasting sense of capability of feeling that they're supported, not just fixed? Something to really consider.
Tune in to the next episode of Case by Case with Aaron Shaw and Claudia Wilson, and listen to more insights, stories, and discussions around workers' comp, DME, and recovery, and Injury Guard Solutions production.
Care that moves you.